All right, so we are live with Dr. Mosh from Performance Rehabilitation and Regenerative Medicine, and Kyle Mahoney of Jack Rabbit. And my name is Steve Sargent, your host for today. Another awesome episode of Ask the Doc. And so we're going to jump in and talk a little bit about runner's pain. And, my hope is that we can kind of get the runner's perspective from Kyle and the physician perspective from Dr. Mosh. And maybe just to start, to kick off, Kyle, tell us just a little bit about you and a little bit about Jack Rabbit.
Yeah, of course. So I actually grew up in this area. I went to Scotch Winston High School. So I ran there for 4 years. Then I ran for Ramapo College for 4 years. After that, I dabbled in both high school and college coaching, some local New Jersey schools, and then out to the Midwest for grad school. And then returned home and I started working here. Kind of cool to come back to my childhood running store, and ended up being the store manager. So that's kind of the story over the last couple of years. I've been here for a couple months, and I have a couple friends that have gone to your clinic for treatment and spoke highly of it. So pretty cool to be doing this. But yeah, it's kind of my.
That's awesome. Thanks for sharing that. So lifelong runner, and now you get to wake up every day and do something you're really passionate about, which is cool. That's something that not everybody can say, right?
Right.
Awesome. And Dr. Mosh, tell us a little bit about you and your background.
Sure. It's good to see everybody. I've been a practicing PT for almost 12 years, focusing on sports ortho, different types of clinics. And I love getting people better, different types of conditions, love runners. They're awesome. So I'm pretty excited to be happy to help out with this webinar and answer any questions and see how we can help you guys out.
Cool. So yeah, just to frame our time, I thought what we would do is really try to kind of identify together, and again, two different perspectives here of, some of the common issues that runners face, and then really just kind of take a look at what options they have, both self-care and prevention, as well as treatment of various conditions. And obviously, Mosh, you can speak to that. Kyle, maybe starting with you, just kind of jumping back to you, as a runner yourself, or even from, your customers and, various groups that you collaborate with, what are some things that you often hear that are maybe pain points for runners?
Yeah, I would say the two biggest ones, shin splints. Everyone gets shin splints all the time. It happens a lot at this time of year, winter track, which is actually a little bit different this year for high schools. But when they're running indoors, especially like in hallways, tight turns, really hard surface, and maybe they weren't doing much activity before that, shin splints flare up a lot. And then plantar fasciitis is the other one. So that's kind of that pain in the arch and in the heel. We hear that 20% of our customers maybe. So, a lot of that has to do with, at least on our end, they didn't have proper footwear. They put 1,000 miles on a pair of shoes, and, they want to know why their feet are hurting. Well, that's a good place to start. But those two things, obviously other things pop up like stress fractures here and there, hips, ankles, knees. Knee pain is pretty common too. Yep. Runner's knee, we hear a lot, but I would say those two are the ones that we hear the most.
Okay. Maybe Achilles as well, tendonitis, tendinopathy.
So that's my literal Achilles heel. Yeah, right. So funny. It's been years of my Achilles basically on and off hurting me. Tried so many different treatments, but I'm also a stubborn distance runner, so I don't listen to the advice I give people and take time off to heal it. But yeah, the Achilles is a big one too. I can speak to that.
Okay. So now, Kyle, do you know James Leitner?
I do. We graduated Scotch Plains in the same year.
Oh, did you? Okay.
Yeah.
Yeah. So James is a great guy. His organization's Mission Clean Water. We probably should have had him on for this one. We'll have to do another one. If you guys, those who are watching, don't know James and his story, look up Mission Clean Water Jack.org. We partner with him throughout the year with various races. And if you're a part of a running group, or just like to run individually, his organization is something that you'll want to check out. But that's a cool connection. So Dr. Mosh, jump in here. The conditions that Kyle mentioned, is that a lot of what you're seeing, and are there others?
Yeah, to Kyle's point, and it's great to have a runner's perspective on this. Those are pretty common conditions.
Mhm.
And I would say there's a couple other ones that we see a lot of, bursitis, IT band syndrome. But the big thing from the rehab perspective, when it comes to runners, we can't really focus on the specific region. You're really evaluating the full kinetic chain, all the way from impact at heel strike, walking gait mechanics, as opposed to running mechanics, and kind of seeing how each joint kind of moves, or lack thereof movement, at certain points during that cycle. And we kind of follow that along the full kinetic change up to the hip and even to the low back. So that's something that we kind of focus on. So in the example of shin splints or plantar fasciitis or Achilles tendonitis, yes, those are your painful areas, no doubt, and those can be stubborn at times. But in order to kind of truly rehab that injury, yes, you have to treat that area, but you have to look at the mechanical factors that are throwing that off. What is causing the dysfunction to irritate those structures? So that's part of the rehab perspective. Ultimately, it comes down to, as I like to say in the clinic, I have to rebalance your equation. So, are you tight here? Are you weak here? How do I rebalance your specific equation? And that's what we see a lot in the rehab world.
Yeah, makes sense. So from a treatment perspective, obviously performance being a highly integrated, collaborative environment, certainly there's a rehab team that comes into play. Things like plantar fasciitis and tendonitis and others, there would be some potential medical interventions as well.
Absolutely. So, when we see a patient, we always collaborate amongst the different disciplines in the office and see what is the best treatment option for the patient. And we educate the patient on what is the best option for them. Specifically to medical intervention, I personally am a big fan of the regenerative medicine options for plantar fasciitis. Love PRP for that. Cortisone works great, but the problem with cortisone, you feel good, then 2 weeks later you start to flare up again, right? It's a band-aid.
Yeah.
So personally speaking, I've seen great results with PRP combined with rehab for plantar fasciitis. So I'm personally a big fan of that option.
Yeah. I know things like EPAT as well. We use for I think plantar fasciitis as well. And some of those other conditions. So even again, some of those modalities on the rehab side can be very, very useful.
Yeah, we like to use on the rehab side specific EPAT. It's a lot of fun. We use our laser. We like to use some of our Graston tools, some of our cupping tools. We like to kind of combine and go back and forth to kind of, properly irritate some of the structures to promote a healing response.
Yeah.
That's kind of the idea behind those.
Makes sense. So on the prevention side, Kyle, I want to bounce back to you and get the perspective, Jack Rabbit of Westfield, and there's a store in Morristown as well, right?
Yeah, the two closest ones to here would be Morristown and Summit as well.
Okay, Summit, right. So yeah, talk to us a little bit about that. I mean, when you have folks come in, what do those conversations look like? What kinds of recommendations are you guys making? Or would you even have for certain folks that may have a problem area who may be watching?
Yeah. So one, the thing that actually fixed my Achilles was EPAT. So it was cool to hear you guys mention that. I tried everything before that, and it is super painful when it's on a problem area. And I had to get 6 treatments, but it did clear up. It ended up being tendinosis. And so there was just so much scar tissue. I destroyed it. I ran way too much on it. But yeah, so I would recommend that as something that if you're running out of options, it worked for me. From a preventative standpoint, the one thing I wanted to say is that a partnership like this is really cool, because while we can put you in the right footwear, maybe add an arch support, maybe show you a foam roller or a calf stretcher. If we see that it's coming from tightness in your hips because we get you on the treadmill, or you don't really have ankle mobility, we can't fix you. I can give you from my experience, hey, do these exercises, X, Y, and Z. It worked for me. We did it in college on my team, whatever, when I was coaching. But one, a lot of people aren't going to go do that on their own. And two, like, it's just, it's a little bit outside of our wheelhouse. You know, we just kind of speak from our experience, but we're not doctors. So, hey, we're going to put you in this footwear, pick up this roller, whatever it is. But go see our friends over at Performance Rehab, because I think you need a little bit more of like a specialized, you know, attention or treatment or whatever it is. So like, just to give examples of what we do here, first and foremost, if you're new and you've never gotten running shoes, or if you're coming in with certain issues like, you know, your calf, your Achilles, whatever, we want to get you on the treadmill to see how you're running, how you're landing, what's happening when you land, to get you in the proper footwear, and then any support that we want to add. And then we do have like a decent selection of recovery tools, foam rollers, calf stretchers, the massage guns that have become very popular now.
Yeah.
All of those things. So compression, things like that too. We're pretty well versed in them, and most, if not all of our staff either ran competitively or picked it up as an adult hobby. So they're into it. So we're all speaking like not only from like just general product knowledge, but from experience, and you know, we can, something hurts, like it's hurt us before too. So that's what we do. But like I said, I love the partnership, because we're not trying to play doctor here. There's people that went to school for that and they know what they're doing. So, you know, we can kind of refer them out after we've done as much as we can do.
That's awesome. So you guys do, I mean, you do some assessment, you do some evaluation, you know, right up front to help guide people. You know, you're not just walking into a sneaker store, kind of looking for the latest model. I mean, you guys are really providing a lot of value to your customers.
Yeah, no, that's the difference between, you know, where you kind of maybe walk into another place and say, can I see this in a size 9? Without really knowing if that's the correct shoe for you. I mean, there's stability and neutral shoes. There's also levels of cushioning. We just know from experience that some fit wider feet. Do you need a wide width shoe? You know, do you need something that's a little bit more narrow? Even like sizing up in a running shoe just because your feet swell, things like that. It's unique to us. And I think it's one reason that I don't think run specialty will go anywhere, even with e-commerce and all these digital things picking up. You take a survey online, it's a lot different than coming in here and having us break down the video for you. So yeah, we do a lot of that stuff here.
That's awesome. Yeah, that's definitely different. And I could see the value for sure. Mosh, I guess from a prevention perspective, or even beyond that, you know, for folks that might be saying, gosh, like, you know, this limits me, but do I really need to see a doctor? You know, what's the point at which we can self-treat, and where does that cross over to, you know, really, they should be seeing somebody for that? You know, talk to us a little bit about that.
Sure, that's a great point. And you know, think about runners. You know, they like to be active, right? And that's the important thing. They want to be active. They don't necessarily want to stop being active. They go into formal care. Is formal care necessary? So when I have, you know, patients who are avid runners, I'm a big believer in a home program, right? That's your maintenance program. What do you do on a daily basis, semi-daily basis? What do you to kind of keep some of the muscles, you know, working properly, contracting properly? What are we doing from a flexibility perspective? One thing I do find from experience is that runners are actually terrible stretchers. So that's something that I spend a lot of time talking with patients about, you know, make sure.
Why is that? Because they want to get going?
They want to get going. They don't realize how important stretching is. It's like, oh, it's easy. I could do it on my own. And I think the biggest value provided to patients is kind of the mind switch. When you're not stretching to feel good or to warm up, when you're stretching to physically lengthen the structure that has tightened and shortened, that usually kind of helps the patient out. So stretching is actually super important. As far as completing the activity, if you're having discomfort, I would say anything beyond a 0 to 1 or a 2, you should get it looked at. You know, aches and pains, you know, aches you could deal with. I wouldn't advise it, because typically what happens, the body does compensate, and you start irritating a structure here because like, oh, you know, I could deal with this, but all of a sudden, why is my other knee hurting when it was a little bit sore on my right ankle? So that happens all the time in our world. So, you know, number one, I'm a big believer in home program and stretching. Number two, if it's anything beyond the like minimal discomfort, mild ache, you should at least get it looked at, and then you can decide with your rehab provider what is the best course of action for you.
It probably goes without saying, and just because it's obvious, but a chronic, worsening condition, obviously isn't going to go away on its own.
Yeah, correct. If this is long standing, if you're trying some things on your own, you take a break, it feels better because you're rested and it comes right on back. That's a pretty good indicator that you should probably get that looked at. Rest feels great because you're using those structures that are irritated, but mechanically you haven't solved the issue that's causing the symptoms in the first place.
Yeah. So somebody comes into performance, with a chronic complaint, in addition to sort of hands-on evaluation, to diagnostics as well. What does it look like to properly evaluate?
Yeah, love diagnostics in this case. Typically, the onboarding physician will take a thorough history and physical examination. And some of the diagnostics we choose to incorporate include X-ray, diagnostic ultrasound. If the symptoms in the history don't line up, you never know if an EMG NCV is warranted. Maybe there's a hidden low back component. Does it warrant a further MRI? So the diagnostics become important to decide what is the level of severity of injury, and see what is the best treatment outcome and provide rehab options to the patient.
Makes sense. Any particular advice? I mean, with regards to stretching, I know we could go down a whole rabbit trail here that maybe we don't want to go down, but before we kind of wrap up, any other pearls of wisdom or advice?
So when it comes to stretching, I like stretching before the activity. So, as part of that warm up to loosen up a little bit, what everyone tends to forget is you really should stretch after the activity. So if you stretch a little bit and you go run 2, 5, 10 miles, whatever it is, you should make sure you stretch afterwards, because that's where you can find the most value in the stretching, where you're trying to lengthen that muscle that has been shortened during that activity. That's a big piece of advice I offer patients. When it comes to runners, you should always stretch, your calves. It's a big muscle group. IT band's a big muscle group. Your hamstrings. Those are all general good places to stretch and kind of help you out.
Yeah. Kyle, anything else from your end? Any words of wisdom or upcoming opportunities? I know the world of races and runs this last year, it's been different for everybody, right? In all aspects and industries, but seems like there are some maybe good upcoming opportunities that at least I've heard of through James and Mission Clean Water. I know they're putting together a race series. What types of things do you guys get involved with?
Yeah, so we always work with James. Every time he has an idea, he comes to me and kind of bounces it off of me. So he's always in here and we're talking about stuff. So anything that he does, we'll definitely hop on as a sponsor and help promote it. Be here to help you guys out. Greta's run, which is a 5K in Westfield. It's kind of like a memorial thing centered around grief counseling and things like that. We're going to end up being like the packet pickup spot, and kind of really help promote that. I don't think they officially launched registration yet, but it's going to be a free 5K. So basically they just want to get people in, see what it's all about, and then maybe make a donation, but they really just want to get people in. So we're partnering with that. We have our own Strava page. So Strava is kind of like a runner social media type thing where you can upload your runs, like and comment, whatever. And so we're looking into, if in-person races aren't going to come back really until the fall, maybe doing some of our own things, virtual challenges and some type of giveaways. So yeah, we're trying to get creative. We're trying to basically just keep people engaged and giving them something to work towards, because right now a lot of people kind of lost their goal race, right? So still coming out here and feeling like it's worth it to get a pair of running shoes because they have something to work towards. And we always post that stuff. So Jack Rabbit Westfield, Facebook, Instagram, anything that we're doing, we'll post it so everyone can see it.
Cool. Awesome. When is Greta's run?
Greta's run, the exact date, let me get it for you. I got it right here. It's going to be May 16th of 2021. So there's still a couple months. And like I said, they're still working on like the registration page and all of that. But as soon as that's all finalized, we'll be sharing and posting that as well. So
Cool. Well, yeah, hopefully we see more and more of those races coming back. I know there are some really cool virtual things going on, and those lots of neat opportunities. And Mosh and his team, performancerehabnj.com. Performance has locations in Branchburg, Somerset, and Watchung. And we'll be excited to get back out to those races too, and just support what you guys do, and support runners in general. Well, thank you both. Appreciate your time today. And for those watching, appreciate you joining us. And we'll do more of these again. We'll see you in a couple of weeks with another great topic. And if you have any requests, you want to see a particular something, hear a particular something, we've done things like taping webinars. If things like that are helpful, useful, by all means, let us know. You could message us through the Performance Rehab NJ Facebook page as well. And again, Jack Rabbit Westfield Facebook page. And thanks for joining us, guys.
Thank you.
Thank you.
All right, we'll talk soon. Have a great weekend.
You too.
Take care.
All right, bye-bye.